I'm Dr. Farmer. I'm here to talk to you about the Jiffy Knee. So when we do knee replacement surgery, there's two typical ways to do this. There's a traditional knee replacement, which makes an incision down the front of the knee. So when we look at a knee here, if we have a knee model here with the leg bone and the thigh bone and your kneecap, traditional knee replacement makes an incision right down the middle of the knee here. You come in here, you have to split this tendon here and move it out of the way from the middle on both sides to expose the knee. When we do a Jiffy knee replacement, the approach is from the inside. So we make an incision, actually oblique incision on the inside part of your knee here, and this allows us to come underneath this muscle that comes out here, move it out of the way, and then we move the kneecap out of the way to expose your joint. That's a less traumatic way, and I think people have less pain, and I think as a whole, on average, people have a quicker recovery. But it is still a knee replacement, and it's a great operation for getting rid of pain and helping prevent instability. But like any knee replacement, there are certain risks involved with it. When we do a Jiffy knee, we do usually as an outpatient. So most, if not almost 95% of people we send home the same day. We bring you to an operating room. We give you a nerve block up here in your thigh, which numbs up the nerve and gives you very good pain relief. That usually lasts for about 24 to 48 hours. We then typically will try to do a spinal anesthesia with sedation. That's going to be numbing you up from the waist down, and it's going to be, you will be sedated, so you're not fully awake, but you will have much better recovery from your brain standpoint, will not typically get the effects of anesthesia, and your pain control will be better, your inflammation will be better, and I think that it's clearly better for people. Sometimes, unfortunately, we can't and we have to do general anesthesia, but if we can, we're always going to do a spinal because it's better for you. So recovery, where the Jiffy knee on average is somewhere between 2 and 12 weeks, you can always see improvement for anywhere up to a year. But there's about 15 to 20% of people who come in here 2 weeks who are no longer using pain medicine, who are not using any assisted devices. They can walk, they can climb stairs, they can be on a bicycle. The majority of people take a little bit longer, but we know on average between 6 and 12 weeks, most people are doing incredibly well. And I have lots of patients who are back on the golf course and who are back driving relatively quickly. In fact, our average return to driving is about 10 to 11 days, even on the right knee, as opposed to traditional knee where we used to tell people it was about 6 weeks before we would let you drive. Having said that, you have to understand that this is a knee replacement and there are certain risks involved with this. So those risks are, number one, infection. It's a very small risk. It's less, just under 1%. Our risk is a little bit less than that. We give you antibiotics right before your surgery, inside your knee at the time of surgery, and I give them to you for a week after surgery to minimize that risk. Because if you get an infection, it is a disaster. It means we have to do more surgery, we have to wash everything out. Sometimes we have to take it all out and start all over again after 6 weeks of intravenous antibiotics. So there is nothing good about an infection. 2, there's a risk of blood clots in your leg. The best way to prevent those is to get up and move. So we send you home, you got to go out of the surgical center, into your car, out of your car, into your house, and we're going to start you in physical therapy within the first few days to get you up and moving. We are also going to put you on a baby aspirin twice a day for about 2 weeks, unless you are already taking some other blood thinners like an Eliquis or a Xarelto or Pradaxa, in which case we'll put you on those starting the day after your surgery. But what we're trying to do is thin your blood out so you don't get blood clots, but more importantly, you don't get a blood clot that goes from your legs to your lungs and causes something called a pulmonary embolus, which at worst case scenario can kill you. Again, that's incredibly rare, but it isn't a zero risk. There is a risk of stiffness. Stiffness enough where after 6-8 weeks, if you're still having problems getting your motion back, I have to take you back to an operating room, give you anesthesia, and bend your knee to break scar tissue. Now again, the best way to prevent that is to do your therapy and do your exercises, and it doesn't happen very often, but it happens. This is what I'm going to tell you about knee replacement surgery. That a vast majority of people are going to do incredibly well, where they have no problems and this gets better and they can do all the things that they want to do. But there's 1 or 2% who really don't do well at all. They get persistent pain, they get an infection, they get blood clots, they end up with a stiff knee that we can't get better, or they get wound complications. So again, it's not perfect, but no surgery is, and no matter how we do it, those risks still exist. Nutritionally, we know that you can do some things to help you decrease your risk of infection and to improve your recovery. So what are those things? Number one, you need to make sure you eat adequate amount of protein every day, and most people don't even come close. We like about 1 gram of good quality protein per pound of body weight, broken into equal portions throughout the day. So for most women, that's going to be at least 120 grams of protein a day, broken into 40 grams of protein at each meal. That's usually way more than most people get. Understand, a chicken breast will typically have between 30 and 40 grams. A 6-ounce steak will have 40 to 50. A cup of Greek yogurt will have about 20, cottage cheese about 23. The reality is, I don't care how you get it, but you need to increase your protein intake because it helps your immune system, it helps your bone, it helps bony ingrowth if we use a non-cemented prosthesis. It's all really important for your long-term health more than anything else, and your needs for protein and amino acids go up significantly at the time of surgery. We're going to ask that you get some essential amino acids prior to your surgery and start taking those. Zinc, magnesium, calcium, vitamin D, vitamin K are all incredibly important for a lot of different reactions in your body in any given second, especially your immune system and your muscle recovery and your resilience. And most people are deficient in at least 1 if not 2 of those. So we use a company called EBM Medical. They make a product with all of those in it. We will have them call you. It's an 888 number. And then you order about 3 months supply. Some of you probably should be on that anyway if you have osteopenia or osteoporosis. But again, that way we can start taking it ideally about a month before your surgery and take it all the way through. Again, decreasing your risk of infection, improving your recovery, and getting you better quicker. Please understand that this knee, whether it's a Jiffy knee or a traditional knee replacement, is not a normal knee. It is a metal and plastic knee. Some people can hear some clicking. When we make an incision on your knee, whether it's the front or the side, you're going to have some numbness on the front of that knee. That's normal, it's permanent. There is nothing I can do to change that. You can expect swelling and warmth in your knee for several months after your surgery. That's also normal. And most people with knee replacements find it difficult to kneel on them. It's uncomfortable to do so. So most people choose not to. Nerve injury, an incredibly rare problem, but it can happen. There's a nerve on the outside of your leg called the peroneal nerve. Now, we don't touch that nerve. We're not going to look for it. But if that nerve is scarred down and you have a really big deformity to your knee, either what we call a knock knee or a bow leg, and we straighten your knee out, that nerve could get stretched or kinked. And if that happened, you could end up with what we call a foot drop, where you would be unable to bring your foot up. The good news is, most of the time, about 80% of the time, that nerve comes back again. The bad news is it can take anywhere from 3 months to a year to do so, and that's usually pretty uncomfortable. And sometimes it doesn't, and you have to be in a splint to keep your foot up so you don't trip over yourself. Again, it's a very rare complication, but it happens, and on people with knock knees, especially with big deformities, it does happen more often. When you go home, you are going to go home with a walker to start with. Now, you can come off the walker whenever you're comfortable and stable. That may be the same day, it may be a couple of days, it may be a couple of weeks. However long it takes for you to be stable is what we want. Because what I don't want you doing is going home, coming off of it and falling down. Because if you do that, potentially you could tear the repair that we do inside and dislocate your kneecap. And then we have to go back in and do more surgery to repair that. And that's never a good thing within the first month or so after surgery. So again, I think the traditional approach to a knee replacement is a great operation. It works well. I think the Jiffy Knee is clearly less traumatic, and in our experience, people do have less pain, and I think on average, a quicker recovery. So I hope this helps, and I look forward to helping you get better.
Have you thought about a knee replacement as a solution? A total knee replacement involves removal of the painful arthritis from the knee joint, and an artificial metal implant is placed for pain relief. In traditional knee replacement, surgeons cut the muscle in the quadriceps tendon for surgical exposure for a total knee. After the surgery, the tendon and muscle have to be repaired back onto the kneecap, which could potentially create more pain after the surgery in front of the knee when bending it. In a Jiffy Knee replacement, the muscles and quadricep tendons are not cut. The same implants are utilized to perform the knee replacement. After the surgery, because the soft tissues were spared, patients have less pain and quicker recovery. Jiffy Knee replacement is a minimally traumatic knee replacement that preserves the patient's muscles and tendons. This allows for faster recovery and less pain. Don't settle for the traditional knee replacement.